Welcome back to the Tip TV Health Show. It gives me great pleasure to introduce a Dr Charlie from Harley, a man who's got more letters after his name than in his name, Dr Charlie. Right, let's talk. We're talking basically about vaccinations, we're talking about illnesses, we're talking now about travel health and malaria. Yep. When I was growing up, I was a teenager, obviously. My father went to Nigeria all the time, okay? And dare I say, he was an accountant and he built a brewery.
Fantastic.
Which I guess that sort of says a lot about me. But he was always having malaria tablets. He was always having the side effects. Okay, and dare I say it, he was a little bit up and down from time to time for health. Malaria, is it now under control?
Unfortunately, it's not. Still, a child somewhere in the world dies every 60 seconds of malaria. We're getting better, but it's not under control. Malaria, the word means bad air, and what they used to think it was caused by bad air because you got malaria around swampy regions. And the reason you get malaria is actually the mosquitoes that hang out of the swampy region. They bite, carry a parasite. It's a female mosquito feeding on your blood. So it's one of the examples of a female bloodsucker.
Right, so I'm never going to catch that in the UK?
Funnily enough, it used to be in the UK, it used to be in the Fenlands, and if you read your Shakespeare, several English kings or people in Shakespeare plays suffered from something they called the ague. And interestingly enough, the cure, or one of the cures for malaria, is cinchona powder from the cinchona tree. And the Jesuit priests managed to get hold of this powder and kept control over it. They had a monopoly on it. And they saved one of the English kings, and that gave the Jesuits huge amounts of power. So that's part of the history of the malaria control. Right.
So I'm off on holiday. Let's say I'm going to Central America, Central Africa. What do I need to do to make sure I don't get malaria?
So first thing, check that it's a malarious area where you need the recommendations. So we say A, B, C, D. The A stands for the awareness. So you now know that you're in a zone where you could get malaria. The B is the bite avoidance, because the thing you want to do is prevent yourself getting bitten by the mosquito. So how can you do that? Those mosquitoes tend to bite early morning, early evening. So you want to cover as much skin as you can. You want to use mosquito repellents that work. And by the way, my colleagues at London School of Hygiene test that by sticking one arm into a mosquito cage without repellent and another arm in the cage with repellent. That is the test.
Okay, so what you're suggesting is there are some repellents out there that actually don't work.
Exactly.
So how do I go into
Well, that's what I'm saying. So you check with whether if it's been tested by London School or Liverpool School of Hygiene, you know it's likely to work. So there are examples of jungle formula, there's Bay Repel, there's Mozzie Guard. All of these have been tested. There are others that are untested, but people believe in them. So a lot of people like citronella, and that was noticed that in the lemon groves you got less mosquitoes.
Right.
The trouble with citronella is you would have to apply it, you know, for every 40 minutes, whereas a normal repellent, you just need to apply it every 4 to 6 hours.
Okay, so basically I'm spraying my knees, my ankles, my arms, early morning, tea time.
So that's bite avoidance. And then in the evening, ideally, you want to sleep under a mosquito net. And that mosquito net is a physical barrier, but you also need a chemical barrier. So the chemical barrier is something called permethrin. So you have an insecticide-treated net. So that net, if a mosquito lands on it, kills the mosquito.
Right.
Doesn't harm you, but it does kill them.
But let's assume I'm a vegetarian, right, and I'm killing mosquitoes. Is that a good thing or a bad thing?
Well, if you had a Buddhist type philosophy where even standing on an ant caused you distress, then that's an issue. I don't have a specific answer to that. But what I do know is one mosquito can kill one human.
Right.
So and it depends on how you want to balance that up. So we got to the B. The C is for chemo, and that is the medication. Now, you mentioned your father was on medication. In his time, it probably was chloroquine and palindrome, which can cause hair loss, can cause some vivid dreams. But for Africa, we don't recommend that anymore. So for Africa, we have 3 recommendations. One has become quite famous. It's Lariam or methyloquine, which unfortunately can send some people mad, especially if they have a history of anxiety and depression. And the British military are currently reviewing the requirement for soldiers to take that particular one for that reason, because a soldier with a gun going a little bit mentally disturbed is not a good thing. The other option is cheaper. It's an antibiotic. It's called doxycycline. The Australians love it, and it has been shown to have the same level of efficacy as the other ones I'm going to talk about. And the final one, which is, it came on the market a few years ago, it's called Malaria. The problem with Malaria is very expensive, so it's going to cost you between £3 to £4 a tablet per day. The neat thing about it is you just take it a day before, every day while you're there, and for only 7 days afterwards. All the others you have to continue for 4 weeks. So for business travel, that is definitely the best one. For short travel, that's definitely the best one.
Right. So just to wrap up on malaria, would you actually go to a country that's got problems with malaria?
Oh, I do all the time, and I love it. I mean, the thing.
So you wouldn't steer clear?
No, I wouldn't steer clear. The people who should steer clear are pregnant women. Perhaps younger children, because it's harder to protect them. The thing about malaria, when it's severe, is that the country will be poor. You can't have a rich country and have malaria as well. And interestingly enough, Rome used to have malaria, and the person who got rid of malaria was Mussolini, because he drained the Pontine marshes. So sometimes you need quite radical procedures to get rid of malaria in the country. We are struggling to get rid of all the malaria that's out there. And before we go, I must mention the D. So there's the ABCD, and the D is for diagnosis. And the reason that's important is this. I can take all my protection. I can take my tablets. That reduces my risk by more than 90%. But there's still a percent of risk.
Right.
So within a year of coming back, if I'm ill, I think to myself, could this be malaria? And I have to persuade my doctor, my GP, whoever it is, this is life-saving advice. Is this malaria? Once you've ruled out malaria, then you can call it whatever you like.
Right.
But rule out malaria first.
If you come back from a sort of a country that's got malaria, for the following year, if you're poor, feeling poorly, you'd always ask the doctor that.
Absolutely.
Have I got malaria?
Yeah, and have the test. Don't take their word for it.
Right.
So once a test comes
And what's the
back,
test? A blood
it's
test?
a blood test, yeah. And we have two types. There's one we can do in 15 minutes in certain clinics, but the more definitive one, they look under the microscope and they can actually see the parasite.
Wow. Okay, let's take a very quick break and then we'll be straight back. Thank you.